Thank you, Mr. Speaker. As co-chair of the Bipartisan Rural Health Caucus, I'm proud to lead my colleagues today in celebrating Rural Health Month. With 61 million people, roughly 20% of the United States population, living across 97% of the country's landmass, delivering health care to every corner of America has required unique and innovative approaches and remains an ongoing challenge. As the primary growers and producers of the food, fuel, and fiber that keeps our country running, rural Americans are also quickly becoming older and more ethnically diverse. Dealing with the challenges of keeping up with the world increasingly dependent on broadband activity support all aspects of life, including health care delivery, can be a challenge. Since 2011, National Rural Health Day has been recognized annually on the third Thursday of November, coming up soon on November 21st, to highlight the dedication of healthcare providers and communities in addressing the healthcare needs of rural Americans. But for those of us representing rural and remote parts of this country, every day is Rural Health Day, as we fight to provide access to even the most basic care services and to work to improve health outcomes and the life expectancy of our constituents. Mr. Speaker, at this time, it is my privilege to yield 2 minutes to Representative Baczynski from the great state of Illinois.
I thank the gentlelady for yielding. Mr. Speaker, I rise today to celebrate Rural Health Month and bring attention to rural healthcare challenges. In the communities that I'm so proud to represent in central and southern Illinois, independent pharmacies are a lifeline. But for too long, predatory drug middlemen called PBMs have squeezed independent pharmacies out of business through their unfair, anti-competitive practices. I recently hosted a roundtable where I heard from several independent pharmacists throughout my district, including Michelle Dyer, the owner of Michelle's Pharmacy in Carlinville, Illinois. In 2022, as PBMs consolidated, she was forced to close multiple locations of her business, leaving 3 rural towns in Macoupin County without access to a reliable pharmacy. Our conversation made clear that we must take action to rein in PBMs who have gone unchecked for far too long. We must pass the Pharmacists Fight Back Act to provide transparency, accountability, and guardrails. We need to protect independent pharmacists and support the health of our rural communities. I yield back.
Thank you very much, Mr. Speaker. At this time, it is my pleasure to yield 2 minutes on the floor to my colleague from Kansas, Representative Mann.
Thank you.
Thank you.
Well, I'd like to thank the gentleman for hosting this special order hour and for yielding me some time. This month, Americans celebrate National Rural Health Month, where we believe every American should have access to quality, affordable health care regardless of their zip code. The Big First District of Kansas is made up of 60 primarily rural counties and is home to more critical access hospitals than any other district in the nation, several rural emergency hospitals, and a number of rural health clinics, community health centers, and federally qualified health centers. This network of care facilities is an essential pillar for providing everyday health services and life-saving care to Kansans. I'm committed to supporting this network and networks like it, removing red tape that handcuffs providers from providing care to rural communities, advocating for increase in telehealth services, and supporting programs that provide a safety net for rural America. While this still is very much a work in progress, we celebrate the dedicated rural healthcare workers, hospitals, and service providers who provide care day in and day out to rural America. We're incredibly grateful for their service this Rural Health Care Month and every month. Thank you, and I yield back.
Thank you very much, Mr. Speaker. At this time, it is my pleasure to yield 3 minutes to the representative from Michigan, Representative Bergman.
Thank you, Madam Chair, and thank you, Mr. Speaker. I'm honored to join my colleagues today in highlighting the accomplishments and ongoing challenges facing access to high-quality health care in rural and remote parts of our United States. Health care providers in areas like Michigan's 1st District work every day to provide the best possible care for patients while overcoming struggles unlike anything facing those in urban or suburban areas. Unfortunately, we have seen a significant increase in rural provider closures, and many of those still operating today are doing so at the razor's edge of financial viability and stability. In my own district, Ontonaga and Aspirus Hospital ended all hospital and emergency room operations earlier this year and consolidated into a rural health clinic. A single provider closing their doors could result in patients having to travel hundreds of miles further to receive treatment, including life-saving emergency care. In 2020, Congress took an important step to address this crisis by creating the Rural Emergency Hospital, or REH, designation. Under this designation, rural hospitals receive direct financial support, more than $3 million annually, and increased Medicare reimbursement in exchange for maintaining 24-hour emergency departments, as well as observation beds and other key health services. However, when Congress created this designation, REHs were not included as eligible facilities under the 340B drug discount program. 340B provides significant revenue for critical access hospitals and other rural providers, helping them improve access to prescription drugs and essential health services in underserved and underinsured areas. This oversight has severely hindered the usefulness of the REH program and made it less likely for rural hospitals facing potential closure to keep their emergency departments open. That is why I introduced H.R. 8144, the Rural 340B Access Act of 2024, along with my colleague from Michigan, Congresswoman Debbie Dingell. This bipartisan bill will make a common-sense correction and include facilities under the Rural Emergency Hospital designation as eligible for 340B. This will further our work to stop rural hospital closures and ensure patients in rural and remote areas can continue to receive essential emergency care. Our rural and remote health providers will continue to do everything in their power to provide top-of-the-line care to their patients. In turn, Congress must continue to address rural health priorities and remove the barriers in the way of that future success. Thank you, and I yield back.
Thank you, Mr. Speaker. I now yield my time, myself time as necessary to make remarks about this very important month and some own experiences that I've had in my district. Coming out of the pandemic, the health workforce shortage crisis in the U.S. remains one of the greatest challenges to healthcare, and we must take immediate transformational action to address it. Increasing the number of healthcare professionals is critical to expanding access to care in rural areas and keeping rural hospitals and clinics open, just as my colleague was talking about. One way to address this issue is by ensuring providers are adequately compensated for their services. The Medicare physician fee schedule is fundamentally broken. The Medicare payment rates have fallen by 29% over the last 2 decades, while the cost of running a practice is estimated to have increased by 3.6%. We need longer-term solutions that provide greater stability and certainty to our clinicians. Congress must pass legislation to stabilize Medicare physician pay so that doctors receive adequate reimbursement to cover the actual cost of providing care, especially in areas of rural America where these costs are higher. For doctors in my district, I'm also advocating for increasing geographic adjustments to ensure provider pay more accurately reflects the uniquely higher cost of healthcare delivery in remote areas like Hawaii. That's why I'm introducing the Protecting Access to Care in Hawaii, or the PATCH Act, which would provide a roughly 24% increase in Medicare physician payments to Hawaii physicians so that they receive a similar boost to their counterparts in other remote states like Alaska. For family physicians like Dr. Michelle Mitchell, higher reimbursements could have made the difference with helping her keep her practice in Hawaii and serving the community she cared for and loved. From 2008 to 2021, Dr. Mitchell owned Hawaii Family Health in Hilo, Hawaii, where she provided primary care services and offered specialty service like nutrition intervention and behavioral health to meet the needs of her patients. However, at the end of the day, after covering her overhead, including paying staff, utilities, and rent, she would only bring home enough money to qualify for food stamps. But she persisted. In an effort to lift herself out of poverty, she started conducting telemedicine visits for patients on the continent where reimbursements were much higher, but this was not sustainable. In the midst of the pandemic, she left Hawaii and moved to Kansas, where she could have a more sustainable practice, leaving behind patients who have struggled to find a new doctor to care for them. In rural places like Hawaii, we lose too many good doctors and as a result, too many loved ones who can't get the care they need to survive. Nationally, the United States is facing a shortage of 40 to 60,000 physicians, and this shortage is expected to grow to 139,000 physicians by the year 2033. In my home state alone, the shortage of physicians is 757 statewide, and this is only expected to get worse. Over the past year, we've had 42 physicians retire, 4 have passed away, 55 moved away, and 212 decreased their work. Over 22%, nearly a quarter of our physicians are already over the age of 65, meaning they should be retiring soon, will be retiring soon, but the sad reality is that they can't because there are too many lives literally at stake to lose even just one more doctor in Hawaii. Unfortunately, given the low physician reimbursement levels in Hawaii, along with the high cost of living and limited affordable housing options, it remains a challenge just to recruit and retain new physicians to our state and encourage our own, quite frankly, our children, our keiki, to join the profession too. And that's why it's so vital we fix physician payment models for rural places like Hawaii, and we really make sure that we support our rural and rural communities throughout this great country. For my constituents on the island of Lanai, they say it's difficult to be born and to die in the place that they call home, in the place that they love. And that's because of their inability to see the appropriate provider and get the care that they need for their health. So I look forward to working with my colleagues to finally fix our nation's broken Medicare payment system. When we give our doctors a fighting chance to serve, we give their patients, our constituents, a better chance to live and to thrive. Mr. Speaker, at this time, it is my pleasure to yield 5 minutes of time, or so much as necessary, to my co-chair for the Bipartisan Rural Health Caucus, an amazing individual, a leader in the field of health and pharmacy from the great state of Tennessee, Diana Harshbarger.
Thank you to my friend and co-chair, Rep. Takuda. You know, there's not a whole lot of difference. There is as far as distance between Hawaii and Tennessee, but we have the same health challenges and rural health to be exact. Mr. Speaker, I rise today to recognize National Rural Health Day and to highlight the work and cause of the Congressional Bipartisan Rural Health Caucus, which I am proud to co-chair with my colleague, Rep. Takuda of Hawaii. Over 60 million hardworking, everyday Americans live in rural communities throughout the United States, and as my co-chair, Rep. Takuda, is fond of citing, with nearly 97% of our nation being designated as rural. Compared to their counterparts living in urban and suburban areas, rural Americans experience lower life expectancy, poorer health status, and more difficulty accessing quality and affordable health care. Rural patients face these challenges due to the limited number of rural health care providers, higher rates of people being underinsured and uninsured, and long journeys to health care providers, sometimes people lacking transportation entirely. And having served as a community pharmacist in rural East Tennessee for over 37 years, I understand the unique healthcare challenges and obstacles faced by our patients and healthcare providers each and every day. It's crucial that Congress takes action to address the issues that rural healthcare providers and patients grapple with, such as workforce shortages, supply scarcities, and reimbursement challenges, limited access to telehealth, and difficulties ensuring their patients receive the care they need. The Congressional Bipartisan Rural Health Caucus is here to provide a forum for members of Congress to advocate for legislative action that will help increase access to quality, affordable health care and mental health services for all rural Americans. As co-chair, I will continue to work to advance the cause of ensuring the long-term sustainability of rural communities. This Congress, I introduced the Bipartisan Rural Physician Workforce Production Act, which improves Medicare reimbursements and enhances the current structure of the Medicare-funded graduate medical education program, bringing more medical residents and doctors to rural areas in need. I also worked with my fellow colleagues in the Tennessee delegation to introduce the Rural American Health Corps Act, which would provide incentives for healthcare professionals to work in rural health facilities in exchange for forgiving medical school loans. In addition to these bills, I'm a proud co-sponsor of the Save Rural Hospitals Act, bipartisan legislation that will aid in curbing hospital closures in rural communities by ensuring fairness in Medicare hospital payments. This legislative work is absolutely critical. And this week, I'm pleased to help introduce with Rep. Takuda and other members of the Rural Health Caucus a resolution supporting the goals and ideals of National Rural Health Day. National Rural Health Day is the third Thursday of every November, and it was established to honor rural communities and the contributions and efforts of rural healthcare providers to address the unique challenges faced by the patients they serve. Given the healthcare disparities faced by rural Americans and the continued difficulty experienced by rural healthcare providers in just keeping their doors open, it's vital that Congress prioritizes improving patient care and access in rural areas. Our rural healthcare professionals and patients showcase a selfless and community-minded spirit, and it's altogether fitting and proper that we celebrate rural healthcare providers and the millions of Americans that rural healthcare providers serve. In recognizing and celebrating National Rural Health Day, we joined a diverse coalition of rural healthcare stakeholders to express a commitment to advancing policies to improve healthcare accessibility and affordability in rural areas in our country. Mr. Speaker, I thank Rep. Takuda and my colleagues for joining in this cause, and with that, I yield back.
Thank you, Mr. Speaker. As you have seen here today, both Democrat and Republican, it doesn't matter which side of the aisle that we may sit and serve on, but at the end of the day, it's about taking care of all of our constituents and everyone that lives in rural and remote America. Mr. Speaker, 80% of rural America is considered medically underserved and face significant barriers to care, including geographic distances and lack of reliable transportation, fewer health care providers and medical facilities, lack of primary care and specialty services, and limited insurance options. And because of these barriers, rural residents often experience worse health outcomes than their urban counterparts, simply because of their inability to access health care. Rural residents have a higher risk of dying early from cancer, chronic lower respiratory diseases, heart disease, stroke, and unintentional injury. Many of these deaths are absolutely 100% preventable. In my district, Native Hawaiian and Pacific Islanders experience greater rates of heart disease, hypertension, and diabetes, and Asian Americans often experience higher rates of late-stage cancer diagnoses. To ensure people living in rural and remote communities have access to quality health care, we must do more to keep more rural hospitals and clinics open, increase capacity and support for rural providers, eliminate barriers to care for our rural patients, all things you have heard from my colleagues today. Before the end of the year, Congress has a long to-do list for rural health. So as we go home to celebrate the Thanksgiving weekend, let's keep a few of these important, critical actions we must take in mind for our constituents. Number one, extending critical rural health programs. Congress must pass legislation reauthorizing a number of rural health programs that are set to expire at the end of 2024. This includes extending key programs like the National Health Service Corps, which help recruit and train aspiring health professionals to rural and underserved areas. The Community Health Center program, which supports 1,400 clinics to provide comprehensive health services to more than 31 million Americans, regardless of their ability to pay. And the Medicare Flex program, which provides technical assistance to help struggling small rural hospitals increase quality of care and improve hospital options. These programs play an important role in strengthening the rural health safety net. Number two on Congress's to-do list, safeguarding telehealth. During the pandemic, telehealth flexibilities allowed providers to care for their patients remotely through the use of a computer or a telephone. The utilization of telehealth and telephonic care in rural areas has been vital to reducing the challenges and burdens experienced by both rural patients and their providers. That's why we must support extending COVID-era telehealth flexibilities beyond 2024 and even making them permanent so that patients can receive timely access to care beyond brick-and-mortar settings. We must also take action to prevent an impending 3.37% reduction in Medicare reimbursements to patients. If Congress does not act this year, Medicare payments will have been cut by almost 10% in the last 4 years alone, which is simply unsustainable and could force providers and medical groups to eliminate services, furlough staff, and implement hiring freezes. Congress must act to ensure Medicare providers have the financial support they need to care for our nation's seniors in rural America and across this country. Mr. Speaker, I have a few more points to make, but at this time, it is my pleasure to yield the floor for 3 minutes to my colleague from the great state of New York, Representative Langworthy.
Well, thank you very much. Mr. Speaker, as a proud member of the Rural Health Caucus, I join my colleagues in celebrating Rural Health Month, and I want to highlight the great work of rural health care providers across my district. I represent rural communities across western New York and the southern tier, the counties along the Pennsylvania line. Many of my constituents will tell you that their access to high-quality, affordable health care is a lifeline, whether it's preventative care, managing chronic conditions, or emergency treatment. In rural areas, health care providers are often the first and sometimes the only line of defense against serious illness. One example in my own district is an innovation by Roswell Park Comprehensive Cancer Institute with their mobile lung cancer screening facility that they call EDDie, which I had the opportunity to tour earlier this month. This program and vehicle takes healthcare directly into our rural communities, offering screenings that catch lung cancer earlier and improve survival rates. It's not the large medical centers doing this alone, but community health centers across my district that are stepping up to fill a gap, like the Southern Tier Healthcare System based in Olean, or Schuyler Hospital in Montour Falls, or the Chautauqua Center with locations across the Southern Tier. There are too many excellent rural healthcare providers to name them all. These centers are the cornerstone of rural health care, providing essential services like primary care, mental health support, and preventative education to populations that might otherwise go without care. I also want to speak to the importance of our community pharmacists. They play a critical role in rural health care. These local pharmacists are often the most accessible health care professional for rural residents that they have the most access to, offering guidance from everything from medication to chronic disease management and advice on appointments. However, our rural communities and their healthcare providers, they face significant challenges. For many families, the nearest hospital or specialist could be hours away. It makes it difficult and sometimes impossible to get timely care. And at the same time, rural areas struggle to recruit and retain skilled doctors and nurses and other professionals, leading to shortages and burnout. On top of that, many rural hospitals and clinics operate on razor-thin margins, and too many have been forced to close their doors. When these facilities shut down, entire regions, counties, communities lose access to essential services, forcing residents to travel even farther for care. And that's why I will always fight for common sense policies that strengthen rural health care, ensuring that no one is left behind because of where they live. I'm proud to lead the Rural Telehealth and Education Enhancement Act, which reauthorizes critical funding for programs that expand telemedicine and distance learning in rural areas. This bill, which is included in the House Republicans' Farm Bill, would invest in new ways for patients to connect with medical experts, improve access to specialized care, and enhance health outcomes in our communities. And with that, I want to thank every single healthcare provider who has dedicated their time and their talents to serving Americans in rural communities. The work you do saves lives and makes our country stronger. Thank you, and I yield back.
Thank you, Mr. Speaker. It is my pleasure now to yield the floor for 2 minutes or as much time as necessary to my colleague from the great state of Illinois, Representative Robin Kelly.
Mr. Speaker, I rise in recognition of National Rural Health Month. Everyone, no matter where they live, deserves access to high-quality health care. But I've heard so many stories from my constituents in rural areas who have to drive for hours to the nearest hospital, or they don't have reliable internet for health care, for telehealth. Today, though, I would like to share a story celebrating the positive impact of rural health care. This mother and her family thrived because they had access to obstetric care in their rural hometown. A local woman from Danville, a town in a rural county of my southern Illinois community, successfully delivered preterm twins because they lived by a hospital with a full labor and delivery unit. The mom and her babies remained at OSF Sacred Heart Medical Center with both of the babies in a level 2 nursery where they could receive 24/7 care. The parents were able to spend the maximum time to bond with their babies while the mom recovered from the delivery. The dad was able to go to work because the hospital was close to their home. The mom could be with their newborns and focus on breastfeeding with one-on-one lactation support. A nearby medical center was especially valuable to these parents who had limited resources and the additional challenge of a language barrier. If OSF Sacred Heart didn't have a birthing center, the mom's only choice would have been a hospital almost an hour away. Imagine going into early labor with twins, driving to an emergency department, and then being told you have to drive even further. No mother should have to go through that nightmare, and I'm so grateful that this mother was able to safely deliver her healthy babies. We can hear more success stories when there is a greater access to maternal health care in every corner of our nation. As co-chair of the Bipartisan Maternity Care Caucus, I introduced the Rural Obstetrics Readiness Act to support the creation of rural health care facilities. As a healthcare equity champion in Congress, I commit myself to deploying additional digital tools in Danville, across my district, and our nation to supplement rural health in-person care. I yield back.
Thank you very much, Mr. Speaker. To continue now my long to-do list for Congress that needs to get done by the end of the year for our rural and remote Americans to make sure that they have the health care that they need. Number 3, we need to fund the government for fiscal year 2025. The House and Senate appropriation bills contain roughly $730 million for grant programs and initiatives that directly address the growing health care crisis in rural America. Rural health discretionary spending is vitally important for preserving and improving access to care for individuals living in rural America. This funding includes resources to support rural hospital cybersecurity, including funding to help small rural hospitals purchase health IT and equipment and address the growing threats on digital patient records. We read about this every single day in the newspaper. They need the support to be able to safely maintain both our health records and take care of their patients. This funding also includes funding for community health interventions, including to address the various crises facing rural America in maternal health, as we have just heard from our colleague, opioid abuse, and mental health. That's why I will keep fighting to ensure we pass a final spending bill that preserves increased funding for rural health care programs. Lastly, number 4, Congress needs to pass a disaster aid package. Earlier this week, President Biden submitted a request to Speaker Johnson on urgently needing funding to support the federal response to Hurricanes Helene and Milton and other natural disasters, including the August 2023 wildfires on my island of Maui. Over the past year, rural communities in the United States have been inundated by several natural disasters, including 17 storm events, 4 tropical cyclones, 1 wildfire event, and 2 winter storms. In June, New Mexico faced 2 major wildfires, and Iowa experienced record flooding from the Big Sioux River, which caused mudslides, washed away roads, and required evacuations. In September, Hurricane Helene caused catastrophic flooding, power outage, and property destruction in North Carolina. Rural communities are on the front lines of natural disasters, which can have far-reaching effects on health and well-being in the immediate aftermath, and in the long term, generationally, it has impacts and trauma that is felt. Damage to infrastructure caused by storms can compromise emergency response efforts, limit access to basic needs, and disrupt access to necessary health care and prescription medication. Storms can also have long-lasting mental health impacts. That's why it's critical Congress pass a disaster supplemental package this year. The President's disaster aid request includes a total of $2.7 billion for the Department of Health and Human Services, of which $260 million would be used to support health center infrastructure and ensure continued access to high-quality health care services in impacted areas. This funding request also includes $244 million to expand substance use and mental health prevention and treatment services, and $159 million to restore services needed by people with disabilities and older adults. Across the country, natural disasters have devastated communities, homes, farms, and businesses, and disproportionately impacted rural America, which is why I am urging all of my colleagues to support a disaster aid package that addresses both the immediate and long-term needs of impacted rural Americans. Okay, Mr. Speaker, today you've heard from our colleagues on both sides of the aisle. The Bipartisan Rural Health Congress, now entering its second year and proudly going into its second Congress, having been restarted by myself and Representative Harshbarger, proudly boasts 64 members on both sides of the aisle and quickly growing. In closing, I want to reiterate our shared commitment to ensure rural health remains a priority as we wrap up this 118th Congress and we head towards the 119th Congress in January. We will continue working with our colleagues to ensure that we finish our to-do list for rural health care this year, continue our bipartisan work in the years ahead, and make sure that every member of this Congress understands the plight, the need, the challenges, but yes, the opportunity and the hopes of rural America. Together, we can and must ensure everyone, regardless of where they live, how much money they have, or their life circumstances, has access to high-quality, affordable, life-saving health care. Thank you, Mr. Speaker, and with that, I yield back.